Coming up on this edition of Southwest TV News. Staff at the Cypress Health Region are fielding questions as to why a Swift Current man waited 3 hours in the local emergency room before seeing a physician. If you have a habit of talking on the cell phone while you're driving, police are on the lookout for you. Following a successful intake with the Memorial Tree program along the pathway, Mayor and Council have now approved a new bench program, which will honor the memory of loved ones. Thanks for joining us here today. The Cypress Health Region is looking to improve on its emergency room services here in Swift Current, following a tragic incident in August. We have more in today's top story. Staff at the Cypress Health Region are fielding questions as to why a Swift Current man waited 3 hours in the local emergency room before seeing a physician. A sequence of events on August the 19th, which led to the death of 45-year-old Michael Line, while sitting in the emergency waiting room, suffering from the early signs of a cardiac arrest. Southwest TV News spoke with Dr. Ivo Radevsky, who explains the process that generally happens when someone goes to the ER.
Well, what would happen first, you will be registered at the registration desk, and then we have an expectation that within 10 minutes the nurse will do a triage. What that means is that she'll have a quick visual assessment as to how you present, and she'll ask you questions, take some history, and then do a nursing assessment, set of vital signs. And based on that, she would decide, what's your level of acuity. In other words, how quickly does the doctor need to see you. So we use the Canadian Triage and Acuity Score system, which assigns level of acuity between 1 and 5, the 1 being the highest, and 5 being the lowest. The 1 we need to see right away because that's usually somebody who is in cardiac arrest. 5 would be, your minor backaches that have been going on for a month, those kind of things that are usually clinic visit type of complaints that can be seen within, 2 hours at the most.
Radevsky adds that following this tragedy, the Cypress Health Region is investigating the matter and trying to find solutions to alleviate the problem. At the top of the list is requesting the installation of a clinical software manager.
I don't know what's the cost involved there, but I think it's available in all the regional hospitals, in all emergency room departments within the province. We are probably the only one that doesn't have it. That will allow the staff to have a better control as to what's happening to each patient individually, at what point in care they're, throughout their hospital stay. It will also give visual alerts if patients are not seen within the recommended time. So we would have expected in this particular case the patient to be seen within 60 minutes by the physician. We didn't have any safeguards in place for that to happen, so what this new system will do is in 60 minutes, if the patient is not seen, an alert will go to the nurse to go and visually and physically reassess the patient, do another set of vital signs, and then we have the expectations that the nurse will communicate those verbally to the physicians, who will then be prompted to go and see the patient.
Also, 2 extra rooms will be added in the ER to deal with the often bottleneck situation which occurs, and further ensuring that at least 2 physicians are on call in the ER during the peak times, and keeping a close eye on nursing shift changes to ensure the utmost in care is always available.
And all I can do is reassure patients, residents, that we'll do everything in our power to prevent this from happening again and to make their experience better and worthwhile.
Southwest TV News attempted to contact family members of the late Michael Line for an on-camera interview. However, our newsroom did not receive a response as of production time. Put your cell phone down and focus on the road, as police are targeting distracted drivers throughout the month of October. If you have a habit of talking on the cell phone while you're driving, police are on the lookout for you. Throughout the month of October, policing agencies across the province are targeting distracted driving in the latest traffic blitz. According to stats from SGI, 26 people were killed and nearly 600 were injured last year due to distracted driving. The term distracted driving refers to using your cell phone while behind the wheel, eating while driving, or other distractions in the vehicle, such as changing the dial on the radio. And following the introduction of new traffic laws in Saskatchewan last June, distracted driving can lead to a number of charges and even the impoundment of your vehicle.
If you are using a cell phone while driving and police catch you for the second time within a year, your vehicle is seized for 7 days. And also, if you're caught by police for driving without due care and attention for the third time within 1 year, your vehicle is seized for up to 7 days as well. And since the year following the implementation of that vehicle seizure law, 35 drivers had already had their vehicles seized.
According to SGI, distracted driving is the top contributing factor in all collisions and the third in fatalities, following impaired driving and speeding. Local residents can now honor a loved one through a new memorial bench program. We have more in this report. The beautiful Chinook Parkway and local parks throughout the city of Swift Current are common areas of enjoyment for outdoor enthusiasts year-round. And following a successful intake with the Memorial Tree program along the pathway, Mayor and Council have now approved a new bench program, which will honor the memory of loved ones. Memorial benches will be located in various parks along the Chinook Parkway and other green spaces around the city, complete with a plaque commemorating a family member.
We have a scheduled fee based on whether it's an ornamental or natural. It'll be between $2,600 and $2,900, once again, depending on what type you choose. There is two choices. One of the benches goes into the irrigated spaces, very similar to some of our existing benches. But we also have more of a natural bench that goes in the unirrigated spaces. So that's the pricing structure, and it'll roll out and be reviewed annually.
Interested individuals wishing to purchase a bench to further enhance the beauty around the city while remembering a loved one are asked to contact City Hall. Well, this brings to a close another episode of Southwest TV News, reporting the stories that matter to you. We always welcome your news tips. You can always reach us here by phone at our studio or by email to contact us at southwesttvnews.com. Also, be sure to join us daily online for the latest news from across Southwest Saskatchewan and so much more at MyLocalTV.ca. And be sure to follow us on a range of social media. Thanks for joining us here today. I'm Carol Andrews.